Have you ever been curious to know the difference between IUI and IVF in fertility treatment? Let's break it down in simple terms. Hi, if you are watching me for the first time, my name is Geraldine. I'm a registered nurse, a midwife, and a fertility nurse. If you are passionate about fertility, pregnancy, women's health, or reproductive education, then you are the right place. So, today we are going to be talking about IUI and IVF and the differences between them. Now, firstly, what is IUI? IUI means intrauterine insemination. Now, in IUI, the sperm is prepared and placed directly inside the uterus around the time of ovulation. The goal is to bring the sperm closer to the egg, making it easier for fertilization to happen naturally inside the body. So, in general, that means that IUI is less invasive, simpler, and less expensive than IVF. Now, what is IVF? IVF means in vitro fertilization. Now, in IVF, medications are used to stimulate the ovaries to produce eggs, and then the eggs are collected and fertilized with sperm in the laboratory. Then, if an embryo develops, it can be then transferred to the uterus. So, unlike IUI, fertilization happens outside the body during IVF. Now, when might IUI be considered? IUI may be considered in situations such as unexplained infertility, some ovulation problems, certain mild sperm related fertility problems, use of donor sperm, and when timed intercourse has not resulted in pregnancy. However, IUI is more successful when the woman has at least one functioning fallopian tube and there are suitable sperm available. Now, when might IVF be recommended? Now, IVF may be recommended if there are blocked or severely damaged fallopian tubes, more significant sperm problem, certain cases of endometriosis, reduced ovarian reserve, some cases of unexplained infertility after treatment, a need for genetic testing of embryos in certain circumstances, and previous fertility treatments that have not worked. So the question would be, which one is better? There is no single answer. IUI may be a better starting point when the fertility problem is mild and the chances of success are reasonable. Then IVF may be appropriate when there is a significant fertility factor that IUI cannot handle. Then another question may be, what about the success rates? Now, success rate depends on many factors, including age, ovarian reserve, quality of sperm, diagnosis, number and quality of eggs and embryos, and the clinic treatment approach. In general, IVF provides more control over the fertilization process, but it is also more invasive, more expensive, and involves more procedures. Please don't choose IUI or IVF simply because someone else became pregnant with it. Rather, your fertility specialist should assess both you and your partner and recommend the best treatment that fits your individual situation. In conclusion, IUI is simpler and less invasive, while IVF is more involved and can overcome a large range of fertility problems. So, the better treatment for you is the one that is medically appropriate for you. If you found this video helpful, don't forget to like, comment, and share with someone today. See you in my next video. Bye.